Now talking regarding dengue updates. Now coming to the grading of dengue fever, that is dengue fever, dengue hemorrhagic fever, dengue hemorrhagic fever 1, dengue hemorrhagic fever 2, dengue hemorrhagic fever 3, and dengue hemorrhagic fever 4. The 3 and 4 is dengue shock syndrome. So dengue fever is fever of 2 to 7 days with 2 or more of the following. The patient should have either headache, retroorbital pain, myalgia, arthralgia, with or without leukopenia, thrombocytopenia, and no evidence of plasma leakage. The dengue hemorrhagic fever 1, there should be the above criteria: dengue fever plus there should be a positive tourniquet test. Positive tourniquet test is you tie a tourniquet and raise the blood pressure between systolic and diastolic blood pressure for 30 seconds and measure the number of peticulae or count the number of peticulae in 1 square inch. And evidence of plasma leakage. Evidence of plasma leakage is, what is the evidence of plasma leakage? One is raising hematocrit and second is polyserositis. Polyserositis means what? Either there should be pleural effusion or pleural effusion or ascites. Thrombocytopenia, platelet count less than 1 lakh and hematocrit rise more than 20% over baseline. Dengue hemorrhagic fever is above plus some evidence of spontaneous bleeding in skin or other organs like black tarry stool, epistaxis gum bleeds and abdominal pain. Thrombocytopenia with platelet count less than 1 lakh and hematocrit rise more than 20% over baseline. So in dengue hemorrhagic fever too, there are bleeding manifestations with the thrombocytopenia and plasma leakage. Dengue hemorrhagic fever 3 involves circulatory shock with narrow pulse pressure, hypotension, cold, clammy extremities, thrombocytopenia with platelet count less than 1 lakh and hematocrit more than 20% over baseline. And a profound shock is DSS, that is dengue hemorrhagic fever 4, undetectable blood pressure and pulse. So this is a new update in the classification and guidelines of dengue fever. So dengue viral infection can be asymptomatic and symptomatic. Symptomatic is classified into mild dengue, moderate dengue and severe dengue. So mild dengue is undifferentiated fever, fever without complications like bleeding, hypotension or organ involvement, or without evidence of capillary leakage is classified as mild dengue. So there is home management for mild dengue. On moderate dengue, there are two classifications. One is dengue fever with high risk and comorbid conditions and dengue fever with warning signs and symptoms. So with high risk and comorbid condition, that is infants, old age, diabetes, hypertension, pregnancy, coronary artery disease, hemoglobinopathies, immunocompromised patient, patient on steroids, anticoagulants or immunodepressants. Dengue hemorrhagic fever with warning signs and symptoms is recurrent vomiting, abdominal pain, tenderness, general weakness and restlessness, mild pleural effusion, ascites, hepatomegaly and increased hematocrit more than 20%. Dengue hemorrhagic fever 1 and 2 with minor bleeds. Severe dengue is with significant hemorrhage, with shock, severe organ involvement, this is expanded dengue syndrome, and severe metabolic disorder. This requires tertiary care. So differential diagnosis of dengue fever and dengue hemorrhagic fever is malaria, enteric fever, pharyngitis, tonsillitis, influenza, leptospirosis, meningococcal infection, chikungunya fever, endemic typhus and scrub typhus, Crimean Congo hemorrhagic fever and Ebola hemorrhagic fever. So hemorrhagic bleeding tendencies, thrombocytopenia and hematocrit rise more than 20%. Initiate IV therapy at 6 ml per kg per hour crystalloid solution for 1 or 2 hours. Check hematocrit if there is improvement and if there is no improvement. If there is improvement, you will give crystalloid with this rate is very important. You will give it 6 ml per kg per hour for 2 to 4 hours, followed by 3 ml per kg per hour for next 2 to 4 hours, followed by 1.5 ml per kg per hour for next 2 to 4 hours. Further improvement, discontinue IV after 24 to 48 hours. Now, if there is no improvement and if there is hematocrit falls, if the hematocrit falls, there is very important clear-cut indication that there is suspect internal hemorrhage. So you have to give blood transfusion. If there is improvement, then IV therapy again with the same rate, 10 to 6 and later 3 ml per kg per hour. discontinue after 28 to 48 hours. If hematocrit rises, then you have to increase the rate to 10 ml per kg per hour crystalloid for 2 hours, and follow which continue this protocol again. So this is dengue hemorrhagic fever 3, that is compensated shock, pulse pressure less than 20, hypotension, systolic blood pressure less than 90, and hematocrit more than 20. So give IV therapy 10 to 20 ml per kg per hour crystalloid for 1 hour. If there is improvement, then you have to give the previous protocol rates, that is for 1 to 2 hours 10 ml per kg per hour, followed by 6 ml per kg per hour, followed by 1.5 ml per kg per hour for 2 to 4 hours. If further improvement, then discontinue IV after 28 to 48 hours. Again, it's same. Check if there is no improvement, you have to check hematocrit. If there is hematocrit falls, then you have to suspect bleeding, then you have to transfuse blood. If there is refractory hypotension and there is no improvement, check for ABCs, that is airway, breathing and circulation, and you have to start on inotrope therapy. If the hematocrit rises, you have to increase the crystalloid rate to 10 to 20 ml per kg per hour for 1 hour. If there is no improvement, you have to do a blood transfusion. If there is improvement, you follow this previous protocol. So if there is profound shock and signs of shock, hypotension, BP is undetectable, high hematocrit more than 20% of baseline, you will give oxygen, immediate rapid volume replacement to give 10 to 20 ml per kg crystalloid solution as rapid bolus over 15 to 30 minutes. If improvement is there, then start IV therapy with 10 ml per kg per hour, followed by 6 ml per kg per hour, followed by 1.5 ml per kg per hour for next 2 to 4 hours. Further improvement, discontinue IV after 28 to 48 hours. Now, if there is no improvement, then repeat. You have to give it again at 10 to 20 ml per kg per crystalloid and colloid. Second bolus over the 15 to 20 minutes. Then you have to check hematocrit. If hematocrit falls, you have to suspect bleeding, then you have to transfuse whole blood. If there is refractory hypotension, look for airway, breathing and circulation. If there is no improvement, then you have to give IV inotropes. If there is hematocrit rises or it is more than 45%, then you have to give IV crystalloid therapy at 10 to 20 ml per kg per hour over 1 hour. If there is no improvement, then you have to again check hematocrit and you have to follow this protocol. If there is improvement in hematocrit, then you have to reduce the rate of fluids to around 6 to 10 ml per kg per hour.